The deadly coronavirus outbreak in China is growing, and that virus has now come to North America. The Center for Disease Control in the U.S. is confirming the first case of the virus in that country. The CBC's Megan Batchelor joins us now from our breaking news desk with the latest on that. Hey, Megan, what can you tell us about this case in the U.S.?
Well, Vashi, the Center for Disease Control says while this is the first case in the U.S., they aren't expecting it to be the last. They are expecting that number to rise. So what we know about this first case, it is a man in his 30s from Washington State. He lives in the Snohomish County, to be particular. This is north of Seattle, and he was traveling in China December and January. He arrived back in the U.S. on January 15th. He started to feel ill on January 16th, and on January 19th is when he went to health providers as he had been reading about the virus and was concerned about his condition. The Center for Disease Control says that he was a very active and participatory patient. He really was on top of these symptoms and knew to reach out. So he had been traveling in the Wuhan area. He had not been going to these animal markets that we're hearing about that are suspected to be the center for where this virus started. So he didn't visit those markets. They say that he also wasn't in contact with anyone who was sick, but he was traveling in that region. So at this point, we know that over 300 people have been infected with this virus. 6 people have died, according to Chinese officials. They are all from China. They are now starting to screen at airports as well in the United States. And so the Center for Disease Control has also sent a team to Washington State to help investigate with this one particular case. And now the priority, Vashi, is to get in touch with anybody who may have been in contact with him since he returned to the United States.
And beyond that, what else is the U.S. doing to prevent this further spread of the virus?
So I mentioned about those airports. Today they added 2 more American airports that they're going to be doing some screening at. And the state, Washington State, held a press conference an hour or so ago, and they talked about how they're going to be managing the potential spread and how they're going to be managing those passengers that are arriving in the United States from China. Take a listen. Oh, sorry, pardon me, we don't have that clip available, but they are going to be increasing the number of airports, so they do have screening set up at LAX in San Francisco and at JFK Airport in New York, but today they added Atlanta and Chicago's O'Hare Airport to that list. So they're managing the flights that are coming into the States, just being at those 5 airports and managing the passengers that way. They also talked about the test that was developed in the United States to detect the virus, and they say that that was successful in this case, and they're going to be sharing that with other partners, both internationally and domestically, Vashi.
All right, thanks, Megan. Really appreciate that update. The CBC's Megan Batchelor from our breaking news desk. So that's how the U.S. is dealing with coronavirus. How is Canada preparing for the possibility the virus could come here? Last hour, I spoke with Canada's Chief Public Health Officer, Dr. Theresa Tam, about that. Here's our conversation. Hi, Dr. Tam. Nice to see you. As I mentioned to our viewers, we will be bringing them the update from the Senate. They're on a quick break right now. We wanted to get the latest information on the coronavirus to our viewers here in Canada who are, I'm guessing, a little bit concerned by the news out of the United States today. The CDC confirming that there is one confirmed case of the virus in the United States, in Washington State. What does it mean for Canada?
Well, I think this is an evolving situation, and this is a novel virus that's been detected in China. So, so far, there's been around 300 cases with 6 deaths. And so I think that we've certainly been in very close contact with our US counterparts in the CDC, and we're aware of the US case. But like the United States, as soon as we heard about the pneumonia cases in Wuhan, we've all been alerting our health systems to prepare and to be alerted to the situation and to ask travel histories from their patients if they come up with flu-like symptoms. So it's not surprising, I think, that with that alerting of the health system in the United States, that they would actually detect a case. So in Canada, we have no cases at the moment and no suspects, but we're certainly preparing for the potential of a first case in Canada.
When you say that it's not surprising that there was a case in the United States, would it be unsurprising to you too if there was one eventually in Canada?
We're certainly prepared for that possibility. So what we've heard to date is that initially in China, they thought that the majority of the cases were connected to a live animal market. And so the hypothesis at the time is animal to human transmission. Now there's increasing evidence that there's limited human to human transmission. And so I think that with that being the case, and with other countries now reporting some travelers to the affected area coming back and being diagnosed positive, is not that surprising. Although we actually have a lower volume of travelers coming from the affected area of China, and we have no direct flights, but we're still preparing.
Is there a concern that with Lunar New Year, for example, and an increase in tourism, or an increase in travelers rather, that could increase the risk here in Canada as well?
Well, I think the important thing is that we've been updating our travel health notice to advise travelers what to do to protect themselves, to prevent getting the illness while they're in China. So not contacting live animal markets, hand hygiene, cough hygiene, not contacting sick people. And when they come back, making sure they tell their physicians ahead of time that they've been traveling and they have influenza-like symptoms. That is all so that we can prepare for the potential of the first case.
Is the first case in the United States, though, a game changer for the way in which this country reacts? And by that I mean, do we need to increase the amount of caution that we're taking? I note, for example, that yesterday there was some announcements around signs that might be put up in the airport. The Vancouver airport has confirmed today, I believe through a media spokesperson, that they don't yet have the signs up, that should happen sometime this week. Like, are the necessary precautions being taken in this country right now? Can you assure Canadians of that?
Well, absolutely. I think we are taking enhanced measures at the 3 international airports, Toronto, Vancouver, and Montreal, that receive the vast majority of the flights from China, the direct flights. We have no direct flights from Wuhan. So what we're doing right now is we are in the process of putting up signs in the electronic screens warning travelers that if they've been to an affected area, to essentially determine if they've been in contact with live or animals, the sick people. If they're sick, they must tell a border service officer. And if that is the case and they've been into an affected area, the border service officer will refer these people to assessment by the quarantine officers of the Public Health Agency.
But are you worried that that sign isn't even up in Vancouver yet?
Well, I think that the current assessment of the risk to Canada is low. But I think that it is
but that
still
changed.
important.
I mean, not that assessment, but things changed today quite dramatically. I mean, there's a confirmed case next door to our country.
Well, I think that's why we have to prepare, and we are putting up these enhanced measures at the airport. But let me just say, quite honestly, this is a respiratory virus that has symptoms like all other respiratory viruses. People can come in if they're asymptomatic. So there's what we call the incubation period, where for a number of days, even someone's infected, they don't even know it, they can come through the border. So our border measures is just one layer of protection. What we've done is alerted the health system of Canada to be on the lookout for potential travelers that may be infected.
But they're not isolating, for example, those with respiratory illnesses or those who have come in, which eventually was a precaution taken under SARS, right? Like moving them to an isolated area. None of that has started yet.
This is already a routine measure at our borders, but with the signage, and we are also going to implement an additional question on those kiosks where travelers have to sort of fill in when they're coming through Canada, whether they've been into the affected area. They will then be triaged, essentially, depending on the risk. And we will be assessing, and if you're sick right on the spot, we will be making sure that you're not infecting others.
The World Health Organization is scheduled to meet tomorrow to decide whether or not they're going to declare this an emergency. Should the WHO declare it an emergency, in what way will that change Canada's response, or will it?
Well, actually, we've been preparing since we first heard about this cluster of pneumonia in Wuhan. So I actually think that we continue on the current pathway of getting the country prepared through what the means that we've just said, particularly the frontline astute health provider, and all the infection control measures in the front line and the hospitals are the absolute key. Those are foundational. We have developed, based on the sequence of the virus that China provided, the diagnostics that we can use to detect this virus as well. So we're prepared. So in some ways, regardless of what the outcome is of the emergency committee, which we will have a look at and determine what Canada is expected to align with internationally, we will be continuing on the preparedness that we've already done. I think that right now, for example, the WHO is advising against any kind of border closures, trade impacts, and they will be making those kind of assessments tomorrow.
Okay, I'll leave it there. Thanks, Dr. Tam. I
Thank you.
appreciate your time today. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.